welcome to Workforce Waves. I am Sonia Boyce.
Happy Thursday. It's Sana Joseph Smith.
Good morning. This is Lori Christian. And before we hop over to our amazing guest for today, I just want to make sure that everyone knows about the Summer Youth Work Experience Program through Vital. So this is a great opportunity for anyone between the ages of 14 to 25 to get some work experience, career exploration. And so if you are interested, give Vital a call, American Job Center, 773-1994, St. Croix, and then, of course, St. Thomas, 776-3700. And you know where the Department of Labor building is located. So if you didn't catch all that, just check us out in the office. All right.
Okay, well, thank you for that. And is there a website that they can go to?
And yes, there is. So vital.gov
VIDOL.
/youth,
Okay.
VIDOL.
Alrighty. So we are deeply grateful to have two amazing distinguished women here in the studio joining us here on Workforce Waves. They're no strangers to the territory. They've had extensive work experience, community engagement, and building foundations and partnerships here in the territory. So I will start with Ms. Webster and then we'll go on to.
Good morning. Happy Thursday. I am Masira Sproul Webster, the Chief Executive Officer at Frederick-Stead Healthcare.
Good morning. I'm Tara Graham Hodge. I'm the Chief Human Resources Officer and the Corporate Compliance Officer for Frederick-Stead Healthcare.
Welcome, ladies. Welcome, welcome, welcome. So we've had you on, Mrs. Webster, the Sproul Webster, because I started knowing you as Sproul and then Webster. So you're no stranger to the Workforce Development Board because you've engaged in our summit. And Mrs. Hodge, she has attended. So we've seen you participated. And but your role right now, and it's been like what, for 19 years?
Almost, actually 18, but yes.
18 years as the CEO of the Frederick-Stead Healthcare Inc. And you've done amazing work because you took it from the beginning stages, and you created with you and your team, you created something really amazing here for us. So what role do community health centers like the Frederick-Stead Healthcare play in supporting both public health and workforce stability? Because health and workforce, or just being in the workforce, they are so important, the critical components. So how do you bring stability to healthcare center, bring stability to workforce development in the territory?
Well, first, I'd like to thank you for the compliments on behalf of our great team at Frederick-Stead Healthcare. Most definitely, the workforce needs to be healthy. At Frederick-Stead Healthcare, our focus is actually on primary care, which is preventative and wellness, as opposed to episodic care. I mean, we do provide episodic care, but you really
Break that down for our listeners, please.
Sure.
Episodic care.
Episodic meaning at the point that someone is really sick, someone may need to be hospitalized. In the case of dental, for example, we want to prevent caries, which are dental disease, right? Too often people come to us at the point the tooth needs to be removed, and you want to save the teeth. And it's the same thing with medical and behavioral health. So we're offering both medical, behavioral health, dental, the whole gamut of services. We're providing services to those who are unhoused. We have had a few success cases where we've been able to get them housed and actually get them into training and get them working, which is what you really want to see, right? So we're trying to provide services that improve the whole being of the individuals as well as the community at large.
Can I ask a follow-up in reference to that? I was having a conversation with some business owners and getting insurance, the self-insurance thing ain't working. I don't even know where the people when they run away and can't get them. So a lot of small business owners can't get or afford insurance, and so their employees end up, by default, using your entity as a huge resource. Are there any ways for, and maybe this is something we can create, but is there any way that these small businesses can partner with you so that their employees and team members can get, service or care? Like, is there anything in place now, or could we work on that? Or what are your thoughts around that? Because, we want our team members to be healthy because we want them to come to work and we want them to be productive. And if they keep having to be sick, then they come to work sick and they make everybody else sick. And it's just a vicious cycle. So I don't know if you have anything.
Absolutely. Thanks for the question. And I'd like to first start by sharing, not by default, Frederick State Healthcare is here for everyone. We accept everyone regardless of your income. We welcome those who have insurance. We welcome the wealthy. We shouldn't be looked at as an option by default. So
I appreciate the education. Yes.
I just wanted to, but yes, there are a few private agencies that have sent their staff to us for occupational physicals, have asked us to come to speak and share the services we provide, so that their staff is aware and they can come and utilize us for care. We serve everyone, as I said, the wealthy, those with private insurance, those who have Medicare or Medicaid, and those who are uninsured. The majority of our patients are those with Medicaid. The second largest group are those who are uninsured. And many of them are the individuals that you're talking about who work for small businesses that don't provide health insurance services. So we have a sliding fee discount program, as well as we offer payment plans. For those that are uninsured, they're not paying, the rate that someone in a higher income bracket might be. It depends on the size of their family and their income limits. And then we have other support services, like we have a prescription discount program. We have, what other services do we have? A few other support services.
So I think we're going to talk, because I think I have an idea where maybe we can get the small businesses, look at the show to just create stuff, right? As if I don't have enough jobs to begin with. But what if there was a concept where the small businesses could get together and work out some sort of system where if their employees need to get something from you all, they don't have to, worry about, oh gosh, I don't have that money right now. It's either pay WAPA or pay this small amount to Frederick State Healthcare. But if we could work out some sort of collaboration or system or network, then maybe the small businesses could, band together, and where they make deposits or something where they collect the bill or they pay for it on behalf of their, team members, so that they encourage their team members for those wellness visits that you mentioned, right? To get there before it becomes an issue. So we're going to talk offline and see what we could do to work that out. If there's anybody out there that has any wants to contribute to that, please reach out so that we can see if we can make that happen, because I think it's important for us to be proactive with our team members' health and not just wait, like you said, for it to become so bad that it's
absolutely
so severe.
And absolutely we'd like to do that. And as you speak about it becoming so severe, that's the main goal for us at FHC, to keep people out of the emergency room. Too often people are waiting until they are so sick that they end up in the emergency room, which that's really not the place for many of the issues they go there for. And it's the most expensive resource. You're utilizing a resource that shouldn't be utilized and costs much more to the territory, to the Medicaid system. Even if they have Medicaid, Medicaid is paying much more for that service than they would have paid for the service if they had visited a primary care provider.
That's an excellent idea. And for somebody, a business listening and who may be sitting on the fence about doing that, make the pitch now for somebody, because it would be easier for you when you go to them if they're hearing that. Make the pitch now to an employer that how that assists with, how that helps with productivity and the health and the stability of their business. So because health good health, excellent health, and
Means
the
your
ability to
employees
function.
are
Yes.
at work, right? They're not homesick for days or weeks on ends. You know, if you can get them into primary health medical home, they're having regular checkups. A lot of the illnesses that too many of our citizens or members of our community are dying for too often, or illnesses that could have been prevented, or if they were found earlier, instead of being found in stage 4, if it was found in stage 1, someone could have a much longer life. They could continue to work, they could continue to be with their children, see their grandchildren, but we have to catch it early, and you only catch it early by going in for wellness checkups.
Yes, and talking about that, the dental, you said you provide the dental services, because Lori Trotman,
Mhm.
she mentioned that we were having a conversation one day, and she mentioned the link between your dental
Yes.
hygiene and your heart,
Mhm.
and that it may be that silent thing that's causing your heart problems, and you don't even know that. And I was like, that's so profound that people don't make that connection, and they take all this medication as opposed to just doing that, fixing your teeth and creating that wellness inside of your body.
But excellent point. Excellent. Tooth decay is a disease. It's an infection that runs through your bloodstream. It can go to your heart. It can go up to your brain. There've been documentations of many people that have gotten seriously sick and died due to the root cause being a tooth decay.
I just wanted to put that on there because when you told me that, and then you talked about the dental services. So Frederiksted Health Center has become a cornerstone in the community, and like you mentioned, not just the Frederiksted community, because it's people, because you have it in Princess, right?
Princess, and we also have another site in the Siam Farm Shopping Center.
Mm-hmm. So you've increased your capacity to serve people, and you're seeing a large amount of people. Is it increasing every year? What have you noticed?
Yes, most definitely it's increased. Back to your original question about workforce and our contributions, I suppose, to the workforce. When I joined, we were at 30 employees. Today we're at 160 employees.
Wow.
Wow.
So we're definitely growing the workforce in the community. Ms. Hodge is going to talk about some of the career opportunities we have and trying to encourage our young people to get involved. Healthcare, most people think on as nurses, doctors, dentists, but there's more than that. So Ms. Hodge can share some of those opportunities. Yeah.
Mr. M. Hodge.
Yes, definitely Frederiksted Healthcare is on the move, and we are growing and we are bringing people on. We are always looking for really great talent to join the organization. This is an organization where when you join our organization, there's a lot of opportunity for you, opportunity to move around the organization, an opportunity to learn a lot of the different careers and the skills that we provide to our workers. We have individuals who work from our security team to our housekeeping team to our billing team to our appointments team, all the way up to our providers in all the different departments. We Frederiksted Healthcare has a team that's out on the road that's helping the community, making sure that they provide services to individuals who may be suffering from drug use, individuals who may be experiencing some sort of homelessness or being unhoused. And that's a team as well that's always looking for great talent, people who want to serve their community as well. We're always looking for providers because we serve 1 in 4 of every person on the island of St. Croix.
Wow.
And so therefore we need to make sure that we have very talented individuals working with us to provide that care. And our providers are some of the best providers that you're probably going to find on this island. They care. They focus on the whole person, not just your physical health, but your mental health, your behavioral health, and they ensure that you can take you from 0 to hero in a good short space of time, right? So if you're struggling, you come to us, you come to our providers. We take a lot of time to make sure that we train our providers. We give them the opportunity to go off and get continuing education so that they could keep up their skills. We make sure that we have good cross collaboration between the providers as well. Our workforce, we try to develop our our workforce as much as possible. With some of the things that we're extremely proud of would be our employees who started as a dental assistant, and we have an employee who's now a dental hygienist. And that's
Wow.
because we have internally we have a grow your own program. And so what we do is we take those people and we say, what do you want to do? You want to become a provider? Well, we're going to help you. And we rally around them. We provide them financial support, moral support. We cheer them on, and then we bring them back so that they could work. I'm very passionate about making sure that people from the Virgin Islands come back to the Virgin Islands and wanting to make sure that we staff our organization with people who are from here, understand the patient population, understand the nuances of the territory, and be able to provide and give back to the service that we need to our community.
Awesome. But talk about your grow your own, and Sana knows that because workforce has education, they have their own. We should say we have we're about to hit that one.
Yeah.
And it is exciting to hear that you have your own efforts you're leading the initiative Grow Your Own. What inspired this approach to building local healthcare talent?
It has been a challenge to recruit providers
Mhm.
overall. Our salaries aren't that high, and cost of living is so expensive. So, and even when we have recruited or been successful, too often it's been a revolving door where they're here for a year or two, and then whether they don't like it or their relatives, their family, their wife, children aren't adjusting, they end up leaving. So that's where we came up with the idea. Let's try and invest in our own staff and help them with tuition expenses, support them along the way, give them some scholarships. And so far, we have a nurse who became a nurse practitioner. She's on board with us right now. We helped her with that. We have another nurse who's away right now studying to be a nurse practitioner. She should be joining us later in the year. She should be back. As Ms. Hodge said, we just had a dental hygienist come back that we sent off to school.
A medical assistant who went off and came back as an ultrasound tech.
Okay, great,
Wow,
right.
yes.
And present out, yes. So we have quite a few positions that we've invested in, and staff has come back and are working with us. But that's a condition for it too, that they come back and work for us. And then along just growing some of the staff that we may not have had to send off, but I'm proud to share that we have quite a few people that started with us as housekeeping staff that are now in positions like billing or registration.
That's what I'm
And-
talking about.
Yes,
Yes.
exactly. So we're real proud
Some
of that.
bragging rights right there.
Yes,
Yes, yes.
definitely.
So how does the program work in practice from recruitment to training to employment? How do you get somebody? Because people are comfortable in being working in a sector or on a job in the same position for years because it's comfortable. They know the routine every day. So how do you get somebody to move from one stage into the next how did you explain upward mobility or increasing their skills, their talents, and just for their well-being? How do you get them or explain to them the incredible opportunities, that come from, yes, small work, but there are opportunities and benefits to
Right.
training?
So, first of all, we always advertise internally for any positions that we have vacant. So staff themselves can apply. Some staff might say, I'm really interested in that, but I don't know if I have the skills, but I'd like to. We're willing to train them. Their supervisors coaching them, talking with them. And I see you have the potential. I see you have talent, recommending a promotion for them, or let's try and train so-and-so in whatever position. For the staff, we have staff meetings, regular staff meetings once a month, where we are again sharing opportunities that are available with the agency, and staff goes to HR. HR speaks with them about opportunities and so forth. So we really try to coach our employees and bring them up.
So do you see potential in the person, or do you wait for them to come? Because a lot of people, they are sitting there untapped, and but they don't know how to approach somebody to say, can you help me? They don't know how to do the ask. When you see that potential, do you give it to them or you wait for them? Because if you don't see the skills, but you see the potential, and the skills can be harnessed, and they can learn it. So how do you, so people listening, for people listening, because we're having a conversation, but for the listening audience, somebody who's sitting there and thinking, they don't know the first approach, the first thing to do to get from stage 1 to stage 2, but they have all these ideas, just sitting there at their desk and seeing things being done, and they know it can be done better, but they don't feel that they will be heard, or that they'll be taken seriously, or they have the skills within them because they're at a level where they have not developed themselves to be there. So what would you say?
So at Frederickson Healthcare, what we're doing is that we're sort of infusing that into our performance management process, right? So supervisors have ongoing communications and discussions with their employees, and they have performance reviews that they're going to do more than once a year. And part of that would be to start discussing what are your career opportunities, where is it that you want to go, and then we have plans that we would put together for someone that expressed a particular interest in that. So that is something that we are working on as a management team to ensure that we empower supervisors and give them the tools and the right words to have those conversations when they sit and meet with their employees, so that we could gather that documentation. In addition to identify your high potential employees or your employees that need maybe some type of development area in a particular thing, putting down plans together so that we could make sure that we target those individuals and get them to where they need to be. And maybe in that process, hopefully they would raise their hand and be a little bit more confident, because they see that we're invested in their growth and we're invested in their development. And then we're actually putting it down and then giving them the tools and the training and the resources that they need to get where they want to go. So, that process is what we're going to be doing as a leadership team, as a supervisory team, a management team, to help kind of encourage those employees who tend to sit back and lie back, to come forward, and let's work together to get them to the next step in their career.
And we've seen some employees that have not done well in certain positions, that have had to be brought in, whether to HR or to my office. But I could still see potential, and HR could still see potential, and we've reassigned them for other positions where they flourish.
That's what I tell them. This is not a good fit. I got to put you where it's a good fit.
Actually, I don't like to use that word. I don't like to use the term that you're not a good fit, right? I prefer to say I'm going to put you on the right seat of the bus. Right? This is a whole, we're a team, we're moving forward in a direction, and you just might be sitting in the wrong seat. So what we're going to do is we're going to put you in a seat that's more comfortable for you, that's more, that helps to focus on your growth and your development. Because I feel everybody's a fit, and we just need to find the right seat to put you in.
Well, when I say right fit, not the right fit for that spot. So this suit might fit me well, but it might not fit you the same way. And so that's what I mean by not a right fit. But whichever term you use, the point is that we have the right suit for you. We have the right seat for you. I just wanted to expand on what you mentioned about the pathway and the documentation. There's a tool that I picked up. I forgot the guy's name right now, but he makes buku money off of it. But basically, it's an illustration of your journey. So for any of the employers out there, or supervisors, managers, if you don't just articulate that pathway for your team members, but create a visual, put it up so that they can see. And with his visual, not only does he put up the pathway, he puts up the salary ranges of each milestone. And it's a visual that stays up in their face, in their cubby, or in their area. And so it's a constant reminder that they have the capacity to decide where on this journey they want to be, right? And if they want to be here, so if they want to be, for example, a receptionist, or go to billing and then go to wherever else, or be a practitioner, well, you need to do this. This requires X amount of schooling, X amount of on the job. Each one has it so that it's not something that's kind of in the back of their head. It's a visual that shows them that they have the power at any point in time to pick where they want to continue on this journey there. And I thought it was such a strong tool, because those that are doing well with their team members have the conversation. But if you want to really excel, you take that conversation and you empower them, and you make the team member, control their destiny, if you will, and they know what they need to do in order to get to the next level.
Okay.
Mr. Perner's his name.
Ah, there you go.
Oh.
Yes. Mark Perner.
Perner, yes. His name is
If
Mr.
we
Perner.
strengthen access to healthcare across the territory, what ripple effects would we see it in the workforce and economy? What would be that first thing you'd see if we strengthen, access to, because you're seeing it from your vantage point of view. But if it's done across the territory with all the other entities, people who are the stakeholders in the game, if they were to match your efforts, they were to partner with you, what would be the ripple effects across the territory? What would that mean for us?
Definitely a healthy community, less absenteeism
Absenteeism.
in both the workforce as well as in schools,
Mhm.
right? In terms of children in school where they should be learning. I think eventually with people at work, working, producing, children learning and studying, you're definitely developing a wealthy community, right? If the community is healthy, they are wealthy.
I would like to add as well that, the studies show that it costs anywhere from $1,000 to $2,000 per person for every time they're absent from work, and absenteeism would be defined as unplanned absences. It takes about 15% of a supervisor's time to whether they reorganize schedules, whether they have to now find coverage,
Do the work
do
themselves.
them work themselves. That's 15% of their time that we're pulling out of their day to manage the fact that a person didn't come to work. And so these costs could add up in productivity and in the ability in having to fill that position with somebody else, in burnout because somebody else is taking on that work. And I think that if organizations start to really look at their numbers, what is their absentee data tell them, they will see that they're losing hundreds of thousands of dollars for the amount of people that are out of work. And that is something that at Registered Healthcare that we take time to look at the stats. What is this costing us? And then make sure that we notify the organization that, hey, we got to do better with our rates. The average absentee rate in the United States is based on the Bureau of Labor Statistics is about 3.5%. If you're above that, then you're not doing very well. So you take some time and look at that data and then put some dollars to it. It starts to be, tell the picture and make the story for you as an organization. And quite frankly, if we don't have to shell out hundreds of thousands of dollars to cover the fact that you're absent, those hundreds of thousands of dollars could actually go in the employee's pocket. And so, employees, you start to make those connections to employees. I think that maybe, hopefully, that they will start to change their behaviors.
So, where are the biggest gaps right now in healthcare access for working families? What do you see the biggest gaps for working families?
I'll tell you what we've done to try and close the gaps is access, right? If you're working and the office is only open to 8 to 5, that's very difficult for the family. It means taking the kids out of school. It means you leaving your job for half the day or, a couple of hours out of the day to go to a medical appointment. So we have services until 7, Monday through Friday.
Oh, wow.
We're open on Saturdays and Sundays.
Okay.
So
All locations?
no.
Okay.
So we are open until 7, Monday through Friday, every night at the Scion Palm location, Monday through Friday. There are 2 nights a week at North Shore that it's open until 7. And presently right now, 1 night a week that it's open until 7 in the Nesbitt facility. On Saturdays, both the Nesbitt and the Mid-Island facility are open from 9 to 5 on Saturdays. And then Sunday, the Scion Farm facility is open 9 to 5. So only the Scion Farm facility is open 9 to 5 on Sundays at this point. But,
You have options.
Right.
Yes. Scion Farm is open strategically, so instead of going to the hospital, you come to Registered Healthcare.
Right.
That's a good point
Yes.
there. Good foresight.
Mhm.
So, how can partnerships between healthcare providers, workforce systems, and employers be strengthened if everybody work together? How can it be strengthened? You're filling those gaps because you notice that the hours that people need, that's the access. You saw that blind spot, so you filled it, you cleared it. So, what other structures do you see that need to be within that workforce system, between the partnerships that is required between healthcare providers, workforce systems, and employers? How can that be strengthened so that the workforce is better, we're functioning better, where the absenteeism that we, just discussed, and it's happening not just in workforce that we're seeing when recently there was an article or I think a Senate hearing where it was talked about, I think it was education. So it's being reflected across in different areas of our community. So what can, you've seen it and you see that as at a larger.
So as I shared earlier, there's some businesses that have partnered with us to provide occupational physicals for their employees, which is a good start because it at least gets the employee into the office. They get labs performed, they get a screening done, they get, at least a medical visit. It should be more than once a year, but definitely even if they only come for that one visit, we can inform them of, whatever might be going on that they may not be aware of. And then hopefully they'll continue with follow-ups, or if they need to be referred to specialists, we make the referrals for specialists. Probably more companies, like you're suggesting, should participate in similar. It's not that many right now, but that would be an opportunity for other small businesses to partner with sending their employees for physicals.
Lori, because you need to say something.
Oh, so I was coughing over here.
I thought maybe because you need to talk, and gotta say, Lori, say something, put it on the record.
Well, actually, I'm heading in a different direction, so I'll let you. Did you?
Go ahead.
Okay. Well, I like to hit on the Samaritan Saturdays. I love that, and I think I'd like you to share with the community about that. I know you have the movie night coming up.
Yeah.
So
we have every second Saturday of the month we have what's called Samaritan Saturday. So Samaritan Saturday is targeted to provide services, comprehensive services to individuals who may be unhoused or partially housed or struggling with some housing situations. And this is an opportunity. Anybody can come, but this is dedicated really to those individuals who are normally marginalized and probably are not very comfortable coming in a setting with all the other members of the community. So they have the opportunity to come in and get medical services and dental services and behavioral health services. Like I said, comprehensive services. And remember, for the goal for Frederiksted Healthcare is not just to provide the services, but it's to kind of develop the whole person. So we want to talk to them about how, do they need to be on medication? Let's help them get housing. Let's help them get a little bit more stable so that in some cases they can go off and join and be productive members of the community and the workforce. So those are the services that we provide on Saturdays. And then we have.
I'm sorry, before you get off of that, what does it look like?
What does it look
Is
like?
it just they just come into your
So actually our team, I'm telling you, we have amazing people at Frederiksted Healthcare. There's a team that actually goes and picks these individuals up wherever they are, if they're willing to come, and bring them to our health center so that they could have these services and then carry them back. We make sure that we provide showers, we provide a restroom, we provide lunch, breakfast bags, etc. To make sure that, again, these
Do you need
individuals-
clothing?
We have clothing, so yes, we do accept clothing. I think that the team would say that male clothing and shoes for sure. Definitely, we provide clothing, underwear, socks, shoes, etc. to these individuals. Sometimes we've done haircuts if necessary for individuals who need this support and services. So
and then also meals on a regular.
Yes, and
Not
the bags,
just
we have yes, we
But during the
right, you're right. During the week we do provide every day actually. We provide breakfast bags, lunch bags, in some cases snack bags in the afternoon for individuals who don't have food. So they
do
can
you
come.
still work with the restaurants? Because I know you had a program.
That's how it started.
That's how
Oh,
That
okay.
is how it started. Thank you. Yes. When we first started the program, we were reaching out to the restaurants and asking them to give us their leftover meals. And that worked for maybe a year or two, and then it started dwindled off. I think with COVID, probably around COVID, it didn't continue. But so what we've been doing is we've been making sandwiches and granola bars, apples, oranges, a banana or whatever,
Sure.
and Ensure and a juice, a juice pack or something like that we've been putting in these bags and having available for them. So that's during the week. As long as our doors are open, they can come and we give that to them. But this particular Samaritan Saturday that Ms. Hart was talking about is one Saturday a month. Now, our doors are always open and they could come anytime. However, they actually said to us they weren't comfortable coming in with other regulars of the community. Could we do a clinic for them? And we responded to that by creating this Saturday. But they, they don't have to wait. Like if they came this Saturday, they don't have to wait for the second Saturday of April. If they have an emergency, they need a follow-up, they need to be seen, they can walk in on any day.
How many, just because I know some organizations, y'all know I'm in a ton of them that would love to support, would you accept if somebody wanted to sponsor a day?
Most
provide
absolutely,
meals?
absolutely.
Yes,
Most
yes.
are,
How many
absolutely.
meals do you usually provide on average?
On average, it's about 20 that come each time. Sometimes
20
it's a little
bunch.
more, but I would say, 20, 25.
Oh, that's
or
very
something like that.
manageable for an organization to support.
To
Okay.
support. And we have had a few organizations that have said, we're going to prepare lunch for that day, or we're
Right.
going to pay the caterer to bring lunch for that day. So, and we want to thank those organizations who have done it. Certain fraternities or sororities, Rotary, different groups like that have said, we're going to do this Saturday. So yes, please.
So I'd like to add one more thing. Frederickson Healthcare, we do have grants that help support a lot of these programs. This particular program that we are feeding, bringing in people, making sure they have housing, we pay for that ourselves. That is fully funded by Frederickson Healthcare. So we are a nonprofit organization. So I'm going to just put a shameless plug. We are a
Do it,
nonprofit.
girl. Loud.
We are a nonprofit organization, a 501c3 organization. Please, if you want to help, you want to get some reduction on your taxes, Frederickson Healthcare is a place where we would encourage you to get that deduction. We'd be happy to create that tax letter. The money, you could see where the money is going. You could just visit our health center at any point. We'd be more than happy to sit with you and share the services so that you know that your donation is being well spent. And this is one of these areas that is currently unfunded. There are no grants to cover the services that we provide. And it is costly to go around the island, pick up these individuals, make sure they get showers, get clothes, get food, bring them in for medical services, etc. And you could imagine that most of these individuals are also uninsured as well. But we provide the service anyway, whether it's medical, dental, or behavioral health care. So we do encourage individuals to put some support to support Frederickson Healthcare.
Absolutely, and I want to piggyback on that. No,
I take notes. I get notes right here.
Absolutely. Another service that we provide that is unfunded is the syringe exchange program that we do. When we started that program several years ago, it was funded by the Elton John Foundation. However, that had a time limit on it. It was a 3-year grant, and the monies are limited. They try to spread the monies throughout the community. So you have your 3 years, and now we're going to support someplace else, another part of the nation. So anyway, bottom line is when that grant was finished, we were so committed to the service that we did not want to just sunset the program. We continue to provide our service, and that again is provided or supported by Frederickson Healthcare. We don't get any monies to support that. And for people to understand the importance of the syringe exchange is not in our efforts to support drug abuse, but to accept that it's a reality and we want to keep people safe, right? We want to keep our children safe, the abusers, share needles, dirty needles. If one is infected, then the next person gets infected. So basically, this is a harm reduction effort that we're doing by providing them clean needles so that we can stop the spread of AIDS and HIV, or HIV and AIDS.
Have you seen an increase in people coming to the center since the different the cuts in different budgets with people receiving benefits from the federal government?
I don't know that I would say we have seen that as yet. It is something that we should probably look at, but I don't know that I would say we have seen it as yet.
Because as you, I think it's like March, maybe possibly after this month in May, but you have a lot of unhoused people that you're helping in the community because they're up front and you're seeing them, are you seeing other people other than the unhoused who are also coming in for those meals? Have you noticed an increase in that, or people coming in to be fed or to be clothed other than the unhoused?
Not to my knowledge at this time. I will tell you, like, for example, during the summertime, we definitely see that. When schools are closed and you don't have the school lunch program, we definitely see lots of families, like children who go to school with their parents. That school is still going right now, so we have not seen that as yet. We had seen it like after hurricanes, definitely we've seen it then. Back with COVID, when the refinery closed, we definitely could say we saw people who we knew before were insured, now uninsured. But right now, to my knowledge, I do not believe, or at least I'm not aware of it. Managers have not shared that with me as yet.
Okay, so I guess that's something on the
Horizon.
that we need to pay attention to. So it's how do we, because I was listening to something in a song, and it was basically saying that people are so concerned about what's happening in their own lives that they don't even have the empathy right now for other people, because you may tell someone that you're having something, you're going through but they're thinking that their problem is worse than yours. So it's like, how do we now start putting it out there into the community that and your resources are they're limited. How do you now prepare for if were this to happen? How would you even prepare for something like this? So that's just not for you to answer, but it's just a thought, because we're
So
seeing so many changes.
We have been looking at the fact that we need to expand services. We are concerned. Right now, we've moved out most of our non-medical staff from our Nisbet facility. We recently built an administrative building up in Princess where we've moved staff. So the staff who were previously in our Nesbitt facility that were not medical care providers, medical or dental behavioral health, we are transforming that area into additional exam rooms, because we realize we need more exam rooms to be able to provide services, as we do see that need is growing, even despite what's going on. We had already realized we needed more exam rooms than we have. If one had been at Nesbitt many, many years ago, you could clearly see the difference in what used to be admin offices that have already been transformed into exam rooms. Just about every room that we can make an exam room, we have been making exam rooms over the years. So we have been trying to expand not only in our hours, but having additional rooms to provide services.
And we are adding a dental.
Great. Yes, thanks. Yes, exactly. All of our sites, well, we have 3 sites right now. The Nesbitt facility and the North Shore facility offer dental services. Facility in Sand Farm does not offer dental services at this time. However, we acquired the empty suite next to our facility there in Sand Farm, and we are renovating. So coming soon, dental services to our Mid-Island office in Sand Farm.
Okay, so you hear that?
Yes.
Okay, so we're winding down the show, and if you could leave our listeners, especially employers and working families, with one message about health and workforce success, what would it be, both of you?
So as stated before, it's important to have a healthy workforce. A healthy workforce is a productive workforce. There's a cost. There's a cost to having an unhealthy workforce. And I think that it's important for all organizations to pay attention to those numbers and pay attention to the dollars and cents associated with that, and then focus their efforts on trying to build wellness programs, trying to partner with organizations such as Frederiksted Healthcare to help develop comprehensive health options for their employees. I think that health when individuals who are healthy, working people are healthy, then they pass that becomes a habit, and then they pass it down to their children, and so that we could start to kind of have a culture of health and wealth for our community. So I think it's important that, you know, as an and as a community as well, I think there's a lot of opportunity for us to kind of build a comprehensive system of healthcare for our organization, so we don't have a lot of competing priorities, and we could focus the limited resources that we have in these specific areas that we need to support our community, which I think will then build a much healthier community as well.
Mhm. I think Ms. Hodges said it all.
Yeah.
I will say, I know that there are a lot of people on the island that do not have medical homes, that still misuse the emergency room. The emergency room should not be someplace for a cold, a headache. Those or you need a medical home. If you don't have one, Frederick Center Healthcare would be happy to welcome you to any of our sites. We provide services to everyone, prenatal, infants, adolescents, adults, seniors. We provide the whole gamut. We accept all forms of insurances, to include Medicare and Medicaid, which some offices do not. Earlier, Ms. Boyce asked a question about people having to decide whether I pay Frederick Center Healthcare or I pay for a medical appointment, period, or I pay my light bill. That is not a choice at FHC. You don't have that burden. We do have a sliding fee. We do offer payment plans, and we provide services whether people can afford to pay or not. So we want people to pay their light bills. We want people to feed their families, and we're here for you. And that's what I would encourage. Definitely consider Frederick Center Healthcare. We want to be your choice in healthcare services.
And you've made the pitch, and not just today, but you've done that over the 18 plus, well, almost 19, right?
Well, so Frederick is actually celebrating 25 years.
Oh,
actually.
wow.
Yes. Frederick Center Healthcare is 25 years old and proud and growing.
Congratulations. You've come a long way. Yes. So and not that you're competing against the hospital, but you provide services that, like you mentioned, it's not everything that somebody, you have to go to the emergency room to take care of. You can go there, and you also, to the Frederick Center Health Care Inc., you also mentioned that it's open to anyone. You can have insurance, don't have insurance, but the services you provide, and you mentioned that was it dental, what else?
The dental, behavioral health, medical, and their wraparound services that we provide. And I want to make sure I clarify that it is not a competition at all with the hospital. It's a partnership. Using the emergency room for illnesses that can be taken care of in a primary care setting is a waste of time for the hospital staff, as well as it's costly. The hospital institution is sort of your highest cost of care and resources. So that is something, especially in a community where resources are limited, you don't want to burden the hospital with visits that should not be occurring there. So this is really complementing and supporting each other. It allows their staff to concentrate on acute care, which is what they should be handling, acute care. If you're not in an acute situation, then you should be seeking services in a primary care setting.
And your hours again, so people know that the option. If it's not urgent, then they can come to you and you can mention your hours.
Monday through Friday, 8 to 7. Saturdays at two of our sites, Nesbitt and the Mid-Island site, 9 to 5. Sundays, 9 to 5 at Mid-Island only.
Okay. So we thank you, both you and Mrs. Hodge, for being here today. And your board member made sure we, because of the importance of the services you provide, and she tracks. That's Lori. Lori tracks what's happening on the national level. So she, especially with workforce, and the fact that we know that your health is your wealth, and without that, you're not able to produce, and the community cannot thrive. So we're so grateful that you're filling all those gaps that you're doing here in the community, and we look forward to having you back. So you can, any closing thoughts before we end the program today?
We thank you very much for hosting us this morning. We really appreciate being able to share Frederick Said Healthcare with your listening audience. And we thank your audience for listening us to as well. We know you have a choice in radio stations. Thanks for listening to this one.
Absolutely, yes. So fans and the people who tune in, our listening audience, we truly appreciate you and the feedback you provide. So thank you, Ms. Hodge. You want to say anything?
I just want to tell the Virgin Islands community to have a safe day. Remember to focus on your health. And for those on St. Croix, Frederick Said Healthcare is here to serve you.
Wonderful. So I guess Jennifer is giving us a few more minutes.
Well, I'll pop in. I just want to say health really is wealth. And yesterday, without getting into all the details, I was assisting some individuals with navigating a potential health crisis on the job. And so this person is not on St. Croix. I wish to a certain extent they had been, but this person is employed, currently does not have insurance, and is unfortunately having to use EpiPens. It is quite costly. And so we were discussing how to get them the care that they need. And fortunately, we were able to make the referral to St. Thomas East End, right? And just knowing what happens over here on St. Croix and being familiar with their program, like with their sliding scale available. So although you don't have insurance, there's no to go to work and basically fall out on the job. That's not helping anybody, right? So let's get you to some serious health care.
Thank you for that reminder, Lori.
Mhm.
Yes, thank you. So we're next week Thursday is Holy Thursday, right?
Yes.
So we completely forgot about that.
Yes.
So next week Thursday is a holiday,
Passover.
so we'll be, I guess, the following
Thursday.
Thursday.
All righty, and thank you all for tuning in. Appreciate you.